we're taking a look at a health issue or concern affecting many people, breaking down the info for you and telling you what you need to know to keep you healthy. Dr. Kalani Brady from the John A. Burns School of Medicine joins us now with this week's topic, which is skin cancer. Good morning, welcome back.
Good morning.
So what are the different types of skin cancer?
Well, first of all, there's the really bad actor. That's melanoma. Melanoma can be associated with sun exposure, but not always. It can be in places where the sun never shines.
Wow.
And it spreads, and it can kill people. So it spreads internally, and it's very serious.
Because some people think, oh, if I'm not in the sun, I'm safe. But as you just said, that's not always true.
Not true with melanoma. The non-melanoma skin cancers are sun-related, and basically, therefore, they're in the areas that get sun: the head, the face, the arms, the hands, the legs. Those areas are prone to non-melanoma skin cancer. The good news about non-melanoma skin cancer, actinic keratoses, the precancerous condition, and also squamous and basal cell carcinomas, is that they're not as dangerous as melanoma.
And can you describe what these might look like, or how does skin cancer look?
Sure. Melanoma is almost always a dark spot, an irregular dark spot that's growing over time. And so that's melanoma. The non-melanoma skin cancers can be irregularities of the skin where the skin is red or bleeding or scaling or pink, or those kind of things that are abnormal that you can see on the skin surface. And then, like I say, that precancerous actinic keratoses are little nodular, sometimes scaly lesions that are skin-related as well, and it's due to sun exposure.
And what are the treatments once a doctor realizes that these spots are cancerous?
The treatments are surgical removal, and especially with melanoma, it needs to be aggressive treatment. In addition to that, radiation therapy is used. Special creams that are skin-cidal that kill skin cancers are used, and special lights are used on the skin of the cancer area to kill the skin cancer.
And how can we prevent skin cancer? Is it preventable?
It is preventable, especially the non-melanoma skin cancer. And the first thing we should do is avoid the sun exposure between 10 a.m. and 4 p.m. when the sun is really high. The culprit here, Christine, is UV radiation, both UVA and UVB radiation. So we have sunscreens that help as well, but the more radiation you are exposed to, the worse the skin cancer risk is. The sunscreens are really important. They have an SPF, a sun protective factor, and it should be at least 30 when we use it. And of course, you've just heard about the bill that has going through the legislature to protect our reefs.
Right.
There are certain sunscreens that are banned now, but the remaining sunscreens are very effective in preventing skin cancer. They should be put on 30 minutes before use, and they should be put on intermittently during the sun exposure, and they shouldn't be left in the car because the car heats up and the heat can denature the sunscreen, so it's not effective.
Don't leave the sunscreen in the car, yet a lot of us, including myself, that's where we leave it, right?
I know.
Because we live
Until I learned that, so did I.
And what about people who say, you know, I'm not going to the beach, I'm not going to be outdoors for a long time. Should they still put sunscreen on every day? Absolutely.
Absolutely. Before going, and that's why having it in the house is better, because you put it on before going out in the morning.
Okay. All right. Well, sounds very good. Thank you so much, Dr. Brady, for stopping by. Always interesting, as always.
Thank you.
All right. Thank you.